Okay, continuing on with part 2. So this has to do with the payer, the supplies, the CPT, the ICD-10. So on this particular one, block 14 is the date of the current illness, injury, or pregnancy. Depending on the payer, the carrier is going to depend on if you have to fill this in for anything other than when you have an injury or pregnancy. So again, on this particular one, you have a couple of qualifiers. There's other qualifiers available, but the two that are most used are the onset of current symptoms or illness or last menstrual period. So we want last menstrual period, especially if the patient is pregnant. We want onset of current symptoms or illness if they're just being seen today. So again, you want to make sure you put the full date in, the date of illness, and then the qualifier would be on the other side of that dotted line. Block 15, your other dates. So enter another date related to the patient's condition, and then the qualifier goes right after the qualifier. That qualifier is going to be one of those 3-digit codes. So initial treatment, prescription, report start, first visit of consultation. And then it will be the date, again, complete date. Block 17 or 16 and 17. Dates patient was unable to work. So that is if you have an injury and you've been injured at work, the doctor takes you off. So they want to know from the date that he initially or she initially took you off work to the day that you can return to work. So that is going to assist in that. For Medicare claims, filling this field may indicate the primary group health plan should be billed prior to Medicare. Okay, block 17. For this particular one, if we have TRICARE or CHAMP VA, if the patient referred is from a military treatment facility, you're going to enter that military treatment facility and attach the form that they send so you can be treated by a civilian. So in this one, referring provider and other sources, again, you're going to enter the name, first name, middle name, last name, followed by the credentials. So this is going to be opposite of what you normally do. If multiple providers are involved, enter one provider using the priority order. So referring, ordering, supervision. On this particular one, you would actually have to have a separate claim form for each one of those. And again, do not use punctuations. Box 17A, you have other ID and referring provider. You're going to put the information into 17B. You're not going to write in the red area. The other ID number of the referring, ordering, or supervising provider is reported in 17A in the shaded area. The qualifier is placed in the small block to the immediate right of the figure, 17A, directly over the NPI. So that NPI number is placed into 17B. For the NUC, defines the following qualifiers used by the electronic format. Qualifier, we have all of those. So that's what's going to go into the small block on 17A. 17B, the national provider indicator of the referring provider is going to go there. For Medicare claims, the provider is also the referral source. As with in-house labs or x-rays, you're going to fill in the provider's name in block 17. If no NPI is available, fill in the provider's appropriate identifier in 17A. You're going to leave it blank in most cases. So again, depending on the scenario that you have, you'll either leave it blank or fill it in. Block 18, we have our hospitalization dates related to the current service. So you were hospitalized again, when you were admitted to when you were released. Block 19, additional claim information. Again, this is designated by the NUC, so unless you've been given specific permissions to fill out, you're going to leave that blank. Block 19, we do have our qualifiers, our reference, so additional identifiers that follow in the qualifiers in there. Do not enter spaces between the qualifier. So again, state license number or UPN. Only fill it out if you need to. Block 19 here, this is going to be, you're going to enter the drug's name when submitting a claim for not otherwise classified drugs. Enter concise description of the unlisted procedure code if given, if you can be given in that confined box. Otherwise, you need to do an attachment. Enter all applicable modifiers with modifier 99. So again, when we get down to the CPT HCPCS area, if they have completed all 4 modifiers, then you would use this box to designate additional. Instructions on transmission types. So available on request or the provider site or by mail. So Medicare has specific information as does work comp. Block 20 for outside lab. This is when you do not perform the labs in-house. We want to make sure that we fill out this, especially if we are billing for the lab and then we are in return, once we receive those funds, sending them to the lab as payment. However, if the lab bills their own stuff, we wouldn't fill this out. So this is going to be utilized for the labs that we actually have to be sent out, and they have to review and provide us with a detailed report back to let us know, did it grow out? Did the culture grow out anything? It's not something that we can do with our lab in-house. So this is going to be for everything that's not marked with the QW modifier. So again, was it sent to the outside lab? Our labs are going to be actually marked with a 90. So did we send some out? Yes or no? And then what are the charges for those labs? We want to enter those into the box 20 onto the charges. Block 21, this is where our ICD-10 is going to go. The indicator, you're either going to enter a 0 for I-10 or a 9 for ICD-9. We don't use ICD-9 as much as we once did, but there are still occasions that, especially for risk coding, that we could use I-9 here, but again, it's mainly going to be I-10, so we want to make sure that we do the indicator as a 0. And then you do have 12 places for your diagnosis codes. You want to put the codes that impact reimbursement for supplies and procedures first before you put anything else. So if you end up with 13 or more codes, you're only going to enter the 12 that actually support medical necessity. And then you do want to, your first listed will be A, then B, C, so forth. Your resubmission code and reference number. Following individual payer guidelines, if the claim is resubmitted or a prior submitted claim, enter the claim type from the list below in the resubmission on the code field, and then the reference number from the original claim submitted. So we need to know that. You're either going to be replace the prior claim, or you're going to void or cancel the prior claim to send a corrected form. Okay, then we're going to enter the 7 or 8 into the resubmission code, and then that claim ID number is going to go into the original reference number. If it's Medicaid, you don't need to fill it out. 23, prior authorization number. So if you had to get prior authorization for them to pay for the claim, we're going to enter that here. Home health, the NPI, National Provider Indicator, or hospice, you're going to use the G0181 or 182. Your CLIA, which is your lab, being able to perform that in-house, you're going to put that 10-digit cert number, so that will actually give prior authorization to any of the labs that you do in-house that has a QW attached. If it is an ambulance, you're going to use that 5-digit zip code. And then the CLIA is for Medicare claims. Okay, your procedure services. So supplemental information such as the National Drug Classification begins at 24A red shaded area. And you're going to enter the NDC number in the red portion in 4 preceded by that number. So in the areas that are red here, you're actually going to start here and enter all of that information across. That gives you additional space to add. However, most of your information is going to be entered in the white portion, and then your NPI is your rendering provider. Block 24A is your dates of service. So on this particular one, if both the from and to fields are the same, you only have to enter the information for most providers in the from and not to the to. However, depending on what you did in Cengage, they could have made you fill in both. So again, pay close attention to your claims and what the carrier payer wants. Groupings is allowed only for services on consecutive days, and when required by payers to provide additional narrative descriptions of an unspecified code, an NDC, a contract rate, you're going to place it there. Do not enter space, hyphen, or other separator between the qualifier and the number. 24A, dates of service continued. So this indicates the actual month, day, and year of the service. Again, we want to make sure that you enter the entire date. 24B is the place of service. Your place of service, you can find that listed in your CPT as well as your HCPCS books, such as an office would be place of service would be 11. Emergency department would have its own. You can, in your study guide, where it says place of service are available here, you can click on that. It is a hyperlink within your study guide, and it will pull it up. You will have questions on place of service, so make sure that you look at that. You'll want to keep that in mind when we do our case studies as well. Block 24, emergency services. You're either going to put a Y in here or you're going to leave it blank if no. So if it is emergency, such as our tracheostomy, we would want to put a yes in there. For Medicare, you're going to leave it blank. 24D, procedure services or supplies. So this is either going to be your CPT or your HCPCS code in the first column under CPT HCPCS. And then you have in the non-shaded area, so you want to enter it in the white. If we need additional information, that goes into the red section again. Our modifiers, you have up to 4 modifiers here. You want to start with a modifier that impacts payment first. And then you have it. If we have more than 4, that's where we're going to go up and enter it into the box that we would enter 99 in to tell which additional modifiers we need. Diagnosis pointer. This is where we're going to do the linking for our ICD-10 codes to our CPT or HCPCS codes. So again, for most CPT HCPCS codes, you're only going to have one diagnosis pointer. So even though you may have multiple lacerations for a finger, a scalp, and a leg, you would utilize one ICD-10, the one that's the largest or the most severe, to link to that combination CPT code for the size that you are coding. So you would only assign one. That does prevent denials a lot of times, except for evaluation and management. You can put up to 4 pointers in there. Again, do not use commas in between the letters. You're just going to write A, B, C, D through there. 24E, diagnosis pointer. For here, non-Medicare claims, enter up to 4 indicators per line. Use no commas between indicators and use all diagnosis codes in block 21 at least once. For Medicare claims, use only 1 indicator per line. Use all diagnosis codes in 21 at least once. It doesn't necessarily mean you're going to use it one time. It means that you can use it one time. They want you to utilize every code that you have up there for a certain reason that you're assigning. Some of the health status codes aren't going to be assigned a HCPCS or a CPT. 24F is our charges. So enter the charge of each listed service. Enter the number right justified in the dollar area of the field. Do not use commas when reporting dollar amounts. So charges is the total billed amount for each service line. Days or units in this particular one, depending on what the CPT or HCPCS is, you're going to use units in most cases. Days could be for the particular E&M evaluation. So units of supplies, units of anesthesia, or minutes, or oxygen volumes. Such as if we had a drug and it was for every 50 milligrams and they give 150, we would put 3 units there. For early periodic screening diagnosis, this block is used for state Medicaid programs and is used. You enter a Y for yes if it's related to the service or a no if it is not. For most payers, including Medicare, it will remain blank. So again, this is going to be for Medicaid. 24H, private payer, Medicare, TRICARE, you're going to leave this blank again. There are some additional information as far as the AVS2, IST, and NU. So again, this is for Medicaid. Block 24I is an ID qualifier. So with this particular one, who is seeing them, if the payer requires a provider ID other than the MPI, you're going to enter that qualifier and then provide the number beside it. There is additional information. Rendering provider ID instructions for 24J. This is the individual rendering the service. In most cases, you're going to have one service provider on there, and that's going to be who's entered. The difference could be that you had not only a nurse practitioner, but you also had an attending physician on the case. The nurse practitioner did the procedures such as a laceration repair. We would want to do the MPI for the nurse practitioner instead of the attending physician. And then you do have information in regards to a company such as a laboratory or other facilities, radiology such as that is who rendered or supervised that care. We would place that there. Part 3.